So one of the other things I've been dabbling with in all of my spare time is with mechanical ventilation. Since we are seeing this more and more and more and more in the transport environment, what else do you think we're seeing more and more and more of? Going back to saying that that ventilator has got the highest probability of killing your patient, but yet is that piece of equipment on your ambulance, helicopter, airplane that you get the least amount of training on. We are seeing more and more and more and more patients that are getting killed or significantly injured with mechanical vents. So over the past couple of years, I've been dealing with these two goofballs, medical malpractice lawyers, that have had issues with transport teams severely injuring or killing a patient. So the things that I tell them to do is many of the newer ventilators these days have some form of data card. Subpoena that card and download it. One of the first cases that I looked at, in a 32-minute bedside to bedside transport time, how many vent changes do you think were made? 28. Let's just turn the knob, press buttons, and see what happens. Do you think if they did 28 vent changes in a 32-minute transport time, they knew what they were doing? Probably not. And then the other thing, the good, the bad, the ugly, and then I don't know if you can read that on the bottom. It says, "Are you effing kidding me?" So the other thing, besides subpoenaing that data card, if it's available, whoever's running that vent or managing that vent, you subpoena their training records. So there is a there is a class out there that's put on by a couple RTs out of North Carolina. They do a 4-day, 4,000 slide, 2-day hands-on class on mechanical ventilation. That's the book. One of our flight paramedics in McHenry went through this class, loved it, was very confident dealing with the vent. Then he went through that 4-day class, brought this textbook back, and I said, "So what'd you think?" He said if Ricardo was smart, our medical director, he said he would take the ventilator off of all the helicopters before we kill somebody. He goes, "We have got no business managing these things." That's a 4-day class. This is down in the state of Tennessee. If you're going to be doing interfacility transports with an intubated patient utilizing a mechanical ventilator, this is 16 hours of training, 16 hours of classroom, and then 4 to 8 hours of hands-on every year. This is from down in Florida, 2 different air medical programs. The first one is self-directed learning. You get on there and you watch the first one is an 11-page PowerPoint presentation. You watch it, you sign off on it. The other one is 6 pages. You read about the ventilator, you sign off on it. That makes you competent. This is one that I was supposed to teach ventilator theory and oxygen therapy in 10 minutes. I had emailed them back and I said, "You know what? I'm going to be able to tell them how to turn the vent on and turn the vent off in the other 8 minutes. I'll tell them some good places to buy clothes so they look really, really good on the witness stand." I said, "Dude, 10 minutes, I'm going to have to respectfully decline. There's no way I can teach this in 10 minutes.